Reg here. I want to introduce you. We have in studio with us, we have Dr. Cassandra Massey. She is a representative here representing the Arkansas Association of Nurse Anesthetists. Now, Cassandra, tell me what this means. What is, because we have this on your bio, DNAP/CRNA. I don't know what all those medical credentials stand for.
Okay. That stands for Doctor of Nurse Anesthesia Practice, Certified Registered Nurse Anesthetist.
Okay.
That's the terminal degree for nurse anesthesia.
Okay, great. So we have this bill here, Senate Bill 184. First of all, just a brief overview. What are you guys trying to accomplish with Senate Bill 184?
Well, one of the things that we found that generally happens is that sometimes healthcare policy and statutes are created not to change things, but to kind of get us up to snuff where we're at. The bill originated in 2015 with us. We had some hospitals and surgeons that were working out in rural areas, critical access hospitals, who didn't quite understand why they were having to sign supervisory papers for anesthesia when that's not their place. So we were looking at why that was there, and in the statute, there's a lot of history behind why our statute reads supervision by, but not necessarily in the presence of a doctor, physician, or a doctor, dentist, anesthesiologist. So they were wondering if there was something we could do because nationally, the federal government has actually done away with supervision. They had it in there for a little while in the 80s where some of these statutes got rewritten. The damage is done.
Yeah.
So we have been working since 2015. We introduced this bill just removing that language. There are opt-out. We could do a whole day's show on just the issues around it. But basically, states can opt out completely from any supervision, and that's a billing issue with CMS. 17 states have done that. 40 states have no supervision requirements of anything. Yes.
Okay, so why so much opposition then? Because this has drawn a lot of opposition, namely the medical society, which I'm figuring out actually controls the state.
Well, in 2015, we drew opposition because we completely struck the language, and we're ready to. We're up for negotiation. We're always wondering, what was with the bill that was a problem. Many of the representatives and many of the people in the healthcare community weren't comfortable with us completely taking the physician out of that equation. We just took it that everyone knew that we cannot order anesthesia, that there would always be a physician equation. Nowhere, as far as I know, in the United States, can we walk around and just say, hey, you need some anesthesia. So usually we get an order for it.
The doctor
we
has
thought it was
to say.
Implied. But we understood that. So they wanted us to put some language in there that left the physician involvement, which was where we come up with coordinated with. And the reason we were asked, we were really hit this session on, this has never been used anywhere. Why this word? Well,
coordinated is the word versus the old word, which is supervision.
Right.
So this word coordinated is actually a compromise.
Yes, it was a compromise that we made so that everybody would understand we were not trying to remove any physician involvement. We would always have to have that. It's actually in our under our Nurse Practice Act, and I'm going to explain to you with that the reason that word, and it came up with one of the oppositions this time, was that we were trying to use a term that we could manipulate. Well, actually, supervision is that term that you can manipulate because it implies that there's more activity going on, that there's more direction going on. They wanted to know why we didn't use words like, consult or collaboration. Well, I'm just going to be honest with you. We come under the umbrella of Advanced Registered Nurse Practitioners, APRNs. These are the highest specialty levels of nursing out there, and we've been around for years. Nurse anesthesia has been around 150 years. We were the first medical specialty of anesthesia. We came around in 31. They come around in 36. But when we were going to put language in, our other nurse practitioners have actively legislation that they're trying to take collaboration out. So we thought we don't want to interject and confuse by using a word that, sometimes costs them up to $2,000 per month that they have to pay just to practice. So, that was self-protection. We're like, we don't open any doors that we've never been had collaborative practice agreements, never needed them, don't need them to practice. So that was the only reason. So we wanted to find a word that actually reflected what we do in the state. 90% of the rural hospitals, 100% of the critical access, and even in urban areas, office-based settings, hospitals, nurse anesthetists work a lot of times with just the surgeons. We don't have anesthesiologist involvement. Those surgeons, the misconception a lot of the legislators had when we would talk to them was that the surgeons, the supervision included that they were actually looking over the drape, telling us, how to
do this,
conduct, and that's not
this
how it
many
works.
cc's or whatever.
Yes.
Yeah.
So if you actually look at, the definition of coordination is two things working together as a group to get a favorable outcome. And I'm paraphrasing that. Everybody can look up Webster's.
Well, it seems like, by the way, we're talking with Dr. Cassandra Massey. She is speaking here on behalf of the Arkansas Association of Nurse Anesthetists. They're trying to get a bill through that seems to be pretty simple to me, but of course, any changes in scope or what it is, any changes in relationships between doctors, surgeons, or nurses is going to draw opposition. So where are we right now in the process? Like, where is this bill?
Well, February 28th, this bill's went further this session than we've ever been able to get it. That's from a lot of education going out there. We did not realize that there was a huge amount of confusion on this bill. And I do think some of the opposition thought we were trying to do the bait and switch because Representative Gonzalez, representing one of his constituents, introduced HB 1283, which had a lot of busy language in it that the Arkansas Nurse Anesthetists Association was never behind. We actually got with that constituent, got with Dr. Gonzalez and said, this language, even to us, were not acceptable to us.
Really?
But if you
Okay.
took that language out, you basically have Senate Bill 181, which is just all we're trying to do is to get our statute to reflect what is actually going on in Arkansas. So we think some of that, but some of the things of the opposition that we've gotten has been so outrageous.
Let's talk about that.
Oh, yeah.
Okay, so the opposition that you've got is going to be fear-mongering to the highest degree. I understand we have an inference that patients are dying because of this, quote, unsupervised care. Specifically, I understand, now, correct me if I'm wrong here, but I understand in the Medical Society's package, two legislators, in opposition to this bill, they actually have misinformation in there that the Arkansas Heart Hospital claiming that children had died in a dentist's office, and then that turned out to not be true. There was a correction that was made. Is that right? Where am I getting that wrong?
There's two things confusing there.
Okay.
The Arkansas Heart Hospital there was a letter written by a surgeon from UAMS using their letterhead, their logo, and in that letter there were false allegations made that there was an unsupervised experiment of using nurse anesthesia that were unsupervised, and that deaths occurred. In the room that day, I knew that was incorrect, but we like to know 100. I mean, we got hit with a lot of things, so we were kind of like, I did not know the letter existed.
So UAMS using that letterhead, UAMS doesn't want them to use that letterhead, right?
I wanted you to let me actually give a shout out to UAMS and the Arkansas Heart Hospital because I got in touch with them immediately. Like, it was a Friday, Thursday, and then on Friday, by Monday morning, before 8:30 in the morning, we had Arkansas Heart Hospital and UAMS very forthcoming in that, first of all, UAMS and the Heart Hospital do not make political points. Their letterhead, their logos are not to be used in political things. They were very quick to come in and to try to correct this. You get toothpaste out of the tube, it's very hard to put back because this was disseminated. One of the local news stations there, Channel 4, actually ran a kind of bias thing on this, trying to increase the fear-mongering.
Say it ain't
Well,
so.
I've reached out to them. I haven't heard back to let us. But with this letter, Arkansas Heart Hospital sent letters, and they asked, what can we do to help this? What can we do?
To try to correct the perception,
And
the false
these are
perception.
stellar hospitals. Arkansas Hospital's been known for what, 2 years in a row as being one of the premier hospitals. Those were adults that they were saying there. They had brought in another physician who had been the past president of the Anesthesiology Association. He's actually from Texas. He threw out information in that room. He picked up a letter, first of all, and said it was from Dr. Bistra from the Arkansas Children's Hospital. And I will confess, I have not gotten in touch with the Children's Hospital. But he read those credentials and just outright started saying that, people had died in dentist office and children had died in that Caleb's Law. And I brought Caleb's Law. This was something that was going to be emotional for me to talk about, because when he said that in that room, I knew what Caleb's Law was about. Our current president of the association, has set in for the last several years with the dental boards, trying to see there are some things going on in dentistry and reporting things that doesn't really keep up with the picture of why there have been some children die in dentist offices, some adults die. What was the problem? Could we be part of the solution? Well, I think it's important to know that Caleb's Law had nothing to do with anesthesiologists or nurse anesthetist. This was a 6-year-old healthy little child. And first of all, I want to say my heart goes out to these families, because they're being used in this particular situation in a way that was beneath the profession of this physician. To come in and to use this child's death, he went to an oral surgeon. The oral surgeon was performing the procedure alone in his office with a dental assistant and a sedation assistant. And this family had no idea. Just like in Arkansas, a lot of people, if you ask them, they did a poll, a junk poll. 600 people called, that was reported out on the television. You ask people this loaded question: do you want your anesthesia done by a doctor or a nurse?
Yeah.
Nurse is
a
wide umbrella. Well,
Yeah.
we think that it would have been better served to do that is to actually help educate and say, if you're in 90% of the rural areas, 100%, and even in these urban areas, do you even know who did your anesthesia?
I want to make sure, though, that when we had these letters, or this letter with the letterhead and the logos, trying to make it look official, that did get put into the packet given to legislators.
And we had heard the rumblings, because they hired 5 more lobbyists when this got through the Senate. I mean, the Senate realized we were able to go in there and have healthy debate. There was none of this. But this is the furthest it ever got. And after those lobbyists, we started getting calls. I actually got brought back into this because of this. We started getting calls that they were out telling the legislators that we were going to be out in homes putting in epidurals, that people were dying. So when we had a person who had worked during that period of time as a nurse and as a hospital said, if it comes up and they say this out loud, then we're going to be able to do that. Well, they did not openly say that, and I do believe it was because of her recognition. But then we found out those letters were in there. So again, when I got the letter, was able to read the letter, got in touch with the heart hospital. They were both UAMS. They're innocent bystanders.
They've been.
They are absolutely and have been nothing. And UAMS is starting a nurse anesthesia program. This couldn't be worse timing. I'm a real proponent of educating. We do have access problems. We have a tsunami of patients that are coming our way, more work than any of us could do. And one of the other things that goes along with that, I want to go back to Caleb's Law is basically having those things expressed to families and being able to start actually keeping up with these occurrences, because I found out through some research that not a lot of places even report dental deaths. So we can leave that, but I hope that they never do that again.
Yeah, absolutely.
There's a lot of tragedy.
So why do you think? Why are they using these type of tactics? It seems these are desperate tactics. Why do they want this bill to fail?
One of the steps, there's a opt-out where states can have the governor, and we would like this to happen, just completely do away with any type of the CMS rule. And it's a billing rule. It has nothing to do with our scope of practice. We are one of the few nursing specialties who can do everything that our physician counterparts can do. Now, facilities, the thing that this bill does not do, that one of the things is that it will not cause any facility to have to change their bylaws or policies to conform to a change. They can continue doing exactly, just as supervision does not require them to have an anesthesiologist there. Every facility can still, it's very permissive, they can decide to do those things. But if we change the language would have to be changed before the governor or the legislature could even say, you know what, it's burdensome, it doesn't really reflect, and it's not a good thing for Arkansas, let's do away with it. I think their biggest fear is that that will go away, and it will increase our competitiveness. We're very cost effective. We're about half the price of an anesthesiologist.
So this bill, if passed, will increase competition.
It could eventually, and actually...
And y'all are for that.
I think everyone should be for that. What do we find when we find that competition's out there?
Mm-hmm.
And, they always come back with this fear-mongering on safety. Nurse and anesthetists have been around 150 years. We are the best-kept secret in medicine. That has been to their advantage. Because, just as an example, supervision, but not necessarily in the presence of, what does that mean? Dr. Dilley, who has been a fierce opponent of this bill, has been able to sit in the legislature, I guess, every time I watch from home, I'm a geek, he's there. Is he taking vacation time off work, or is he supervising, not necessarily in the presence of, while nurse anesthetists are there? We have not done a good job. And we've talked about this, of educating the public on who we are.
Mm-hmm.
When they come up and we say nurse anesthetist, the assumption is we're anesthesiologists. We're going to be doing your anesthesia. We've always done that. The doctors are not opposed to taking credit for that work, as long as that supervision's there and there's some misunderstanding that...
And to be clear, you guys only give people drugs when you're ordered to do so by the doctor in the first place.
Yes. We can ask for prescriptive authority but we can't write narcotics. That does not fall under our umbrella. We can only do what is under our scope of practice. We have to have a physician's order. And they were really upset about, Representative Wardlow, he got a little loud and a little emotional about, we're just going to go out and set up pain clinics.
I remember that. I was in the room for that.
Yeah. We're a part of this solution. We are begging to open up our full scope of practice in every place you can so that we can do regional blocks and different things like that for pain control, especially in acute pain. There's a whole gamut of pains out there, chronic pain, acute, but there's things that I can do for you prior to your having an incision and a cut that will help you through that process where you don't have to take narcotics. Some patients take none, or just automatically you wake up, that area that's inflamed stays inflamed for a few days, but as it goes down, that's where most of the pain. So if we can do things, they need to be opening that up, not fighting us on it, because there are approximately 690 nurse anesthetists in the state. There's only about 290 anesthesiologists, and they are primarily in 4 areas. In Fayetteville, Little Rock, Fort Smith, and Jonesboro. So if you're not in those areas and you're out in the rural areas and the critical access hospitals, we need to be able, if you have your total need in one of those hospitals, we need to be able to do that, which we can. The doctors order it. We go out and personally train. Everybody worries about what you learn when you were in school. Well, medicine changes daily. We actually, as an association, brought in one of the anesthesia training groups that does regional anesthesia, known across the country, had them come in so that nurse anesthetists from Arkansas could actually train and have hands-on to get better at these to help fight the opioid crisis. In no way, I can go set up a pain clinic today. I can get a physician to partner with me. We may not, because of an Arkansas statute I don't understand, we may not can be partners equally because they can't have a non-efficient partner, but we could actually do that now. And they're saying that this word change, we want the word change to reflect what's actually going on. We are going to go out and educate the public now because we realized.
So where does this bill go? We're running out of time here. We're talking with Dr. Cassandra Massey, Arkansas Association of Nurse Anesthetists. Where are we here with Senate Bill 184?
We got through the Senate and went over to the House. Of course, we got a vote of 10-10. We thought we had the 11 votes till that packet showed up with the deaths and the false. So we are actively trying now to redo some of that damage, meeting with some of the representatives, and we hope to be able to run this bill.
Well, a lot of times committees, if they find out, people on the committee, if they find out they've been deceived, they tend to reverse their vote sometimes just because they don't like to be deceived.
Well, we totally underestimated our opposition because we thought it was, and with the confusion, But the one thing we couldn't do, we almost have to run the bill again because we have to get in that room. We can't leave those accusations out there. And by the way, Arkansas Hospital, from the letter, I have it here if you want to read it, says that not only was, they never had a CRNA working without physicians. There were absolutely no deaths during that period of time. That was mentioned in that letter. So I want to get that out there, that's complete fear-mongering. So we're going to have to do a better job.
So the headline here, nurse anesthetists are not, you guys are not mass murderers. You're not going around killing folks. So.
Well, no, and the biggest message is that we've been out there in Arkansas, and from now on with the public, ask who's doing your anesthesia. You might be surprised because even we have stacks of letters from surgeons in urban areas who work singularly with CRNAs safely and have done that, who say this having to sign off that they're actually supervising something that they're not experts. Anesthesiologists, nurse anesthetists, we are experts in the field. We do what we do. The surgeon needs to be concentrating 100% on what they're doing. They need to trust and know that I'm up here. They know I know what I'm doing. You know why? Study after study after study shows there's absolutely no difference in outcomes whether an anesthesiologist or a nurse anesthetist does these things.
The bill is SB 184. Dr. Cassandra Massey, we appreciate you being with us.
Hey, I appreciate you letting us come here and just try to take care of some of this.
Yeah, we'll keep following
invite me back anytime, and that goes for any place that would like to have us out to speak.
Well, I wanted to set the record straight because people were telling me what UAMS and the Heart Hospital had done. Of course, it wasn't them, but their letterhead was being used. Anyway, we got to go.
No.